Hello, I'm Dr. Wintereg, and for this week's Tip of the Week, I'd like to cover a few basics of the new patient exam. Now, one thing I'm not going to discuss is how long your new patient exam should take. This is a clinical decision, and I'm not going to tell you how to be the dentist. I've heard doctors say they can do a comprehensive exam in 5 minutes, and I've had others say that it takes them an hour and a half. But what we know is that it needs to be a thorough exam. It needs to be a comprehensive exam that leads to a comprehensive treatment plan. But there are two key factors here that I think are critical. First of all, do not use dental terms to scare the patient during the exam. For example, looking at your assistant and saying number 13 needs a root canal oftentimes is going to turn something on in their mind, and they're like, I'm not having that done. And then we wonder why they don't return for their cleaning or their consultation visit. My typical exam I would talk about prior to MGE. They need a root canal, we need a consultation from the oral surgeon, we're going to do a crown here, we need a consult on an implant, whatever it might be. And one day I realized that during the exam, I'm probably just scaring the patient to death. So the key here is change using dental terms to abbreviations. So in my office, I no longer said crown during the new patient exam, I said CR. Root canal became RCT for root canal therapy, oral surgery consult was an OS. So come up with shorthand and then tell the patient what you're going to do before you do the exam. Something like, we're going to sit here today and my assistant is going to record what I find. I'm going to use numbers, I'm going to use abbreviations. It's kind of a shorthand that makes this go faster, but before I do any treatment, I will sit down with you and go over whatever you need and how much it's going to cost. So you're letting them know they're not supposed to understand anything. Now, you can go right into the consultation after that, depending on if you have enough time, and that's the subject of other videos. My advice, though, is do not use terms that will scare the patient away, number one. Secondly, do not let the patient, when they sit you up, bait you into giving them a price. Tell me what it's going to be, doc. Just give me a range. I won't hold you to it. Well, they absolutely will. You say it's going to be $3,000 to $5,000 and it turns out to be $5,000, they're going to be upset because you said $3,000, because the lower number is the only one they're going to hear. So the key here is do not use big terms, get the data, put together the comprehensive treatment plan, and then you can sit down and explain to them they need a root canal, and if their eyes go up like this, you're going to have to handle that. Then you can tell them how much it's going to be, how much the insurance is going to cover. If you can do that in the same day, great. Oftentimes you're too busy and they have to come back. This will help assure they will return for that cleaning and consult. And that's my tip of the week.